Our first speaker today is going to be Professor Marc Potenza, Professor of Psychiatry and Neuroscience, Yale University School of Medicine. And Marc is going to share some of the kind of experiences that we have and also some of the global activities that he's running around the world. Marc, please.
Well, I think we had a little technical difficulty, and hopefully we've overcome that, and that will be our technical difficulties for the session. So I'd like to welcome you to the ISAM Gen session. I'll be stepping in for Antonio Verdeo Garcia, I believe, and I'll be talking a bit about some of the work being done within ISAM and also with other international organizations, as I think it's important for us to be able to work together as addictions are a global problem. So I have a series of disclosures with respect to gambling, gaming, pharmaceutical, and legal entities. And as I mentioned, we are working within a global community. And while addictions do impact people around the world, there may be differences in different jurisdictions with respect to cultural differences, policies that may differ across jurisdictions, other aspects of the environment, populations, and other factors. And I think historically, most of the research that has been conducted in addictions and in other areas has been on so-called weird populations, the Western, educated, industrialized, rich, and democratic populations. And if we're going to really try to address addictions more effectively, I think it will be important for us to work together around the globe to gather information and then translate that information into better policies, better prevention efforts, and better treatments. So one of the things that has happened over the past several years that I think everyone is aware about is the COVID-19 pandemic that has changed a lot of the ways in which we have been functioning around the world. And going back now over 2 years, during the onset of the pandemic, people were experiencing many questions, many uncertainties. There were changes with respect to employment, and other stressors, lockdowns. So in this setting, I believe this was a stressful time for most people. And during that time, the International Society of Addiction Medicine thought it would be important to try to gather information on what people were experiencing. And so during that time, at the onset of the pandemic, ISAM initially convened several webinars to try to bring people from around the world together to create a forum to discuss what was happening with respect to addictions during the onset of the pandemic. And I think the group was successful in terms of bringing in people from multiple jurisdictions, regions around the world. There were people like Nora Volkov, and Vladimir Pozniak, who participated in these webinars to try to talk about how different agencies were addressing this emerging concern. And during that time, and these presentations are available still on the ISAM YouTube, but during that time, ISAM also thought it would be good to try to gather data. And efforts to do so were spearheaded by Drs. Ectiari and Baldacchino, and they put together these surveys to try to understand what was happening during the onset of the pandemic. And so this is one of the publications that was generated with data that were collected during the first week to month of the pandemic. So during that time, there was a survey where ISAM reached out to members, care providers who were professionals in the addiction medicine space, and surveyed 177 addiction medicine service providers from 77 different countries. And the countries represented are displayed here with the heat maps indicating the numbers of respondents or participants per country. And this initial study found that there were overall decreases in drug supplies, increases in drug prices, increased use of some drugs, but also some of the practitioners reported that they thought that there was decreased use of some other drugs during the onset of the pandemic. Another paper that was generated looked at the reorganization of substance use treatment and harm reduction services during the onset of the pandemic. And the same individuals were surveyed. And in this publication, 88% of respondents reported continuing to provide care for people with substance use disorders. Close to 40% of the care providers reported shortages of opioid replacement therapies like methadone or buprenorphine. And a similar proportion reported partial discontinuation of harm reduction services. And a larger proportion, a majority, reported negative impacts on overdose interventions, and particularly that outreach services were impacted in a negative way. So given the relevance of being able to rapidly collect information, the next step that was discussed was generating this global expert network. And how we might use expert elicitation as a research tool and to be facile to pivot to crises that may emerge at points in the future. And this has been further developed. We'll hear from some of the individuals who have been spearheading this effort. But I think, as was mentioned, this is an effort that involves people from different jurisdictions at different levels of training, and brings together groups of individuals to try to create something that will be helpful in terms of collecting information and then leveraging that to have impact on the field. So more locally, we at Yale have been trying to do something similar, and we have, and some of the people who are involved in the Yale Global Addiction Faculty Network are involved in ISM Gen. For example, Jenna Butner was one of the people who was on Dr. Akhtiari's slide. But we've also worked with other organizations and groups. We heard a bit earlier in the conference about some of the work that ISAM and or the International Society for the Study of Behavioral Addictions has been doing. And we've been partnering, for example, with respect to the plans for the conference next year that will be held in Incheon in South Korea. The International Conference on Behavioral Addictions that will be held in August of 2023. But we've also partnered with the University of Gibraltar and with Yale University on some gambling regulation webinars, where we've tried to bring together a group of international speakers to consider how gambling regulation is being considered in different countries and regions around the world. So one example of this was a webinar that we held earlier this year in April, where we had speakers from Asia, Europe, and North America talk about how the policies within their jurisdictions were put into place with respect to regulation of gambling. We have since had several others that have focused on gambling interventions and their effectiveness, as well as ways in which industry and academia might work together to consider how best to safeguard people from developing gambling problems. We've also been working on multiple surveys internationally. So some of these have been in the space of behavioral addictions. For example, Maeva Flael, who is now joining a World Health Organization work group that has focused on behavioral addictions over the past several years. She spearheaded a binge watching survey that included a double-digit number of countries, so that we could understand across jurisdictions how binge watching might be assessed and it might relate to mental health measures. More recently, Bea Botha, who is now at McGill University. She trained at Vasarhelyi University in Hungary. She is leading an international sex survey involving 45 countries. The Open Science Protocol was published last year, and the data collection has been completed. 43 countries met the milestones for recruitment, and we've recruited over 80,000 individuals into this survey from more than 40 countries. And so we're beginning to analyze those data, but believe that this is a way in which we can get a more complete understanding of how sexual behaviors might be experienced in different jurisdictions around the world, and how there may be similarities and differences across the jurisdictions. And we, with Tanya Moretta and Shubao Chen from Italy and China, respectively, we're now spearheading a social media survey, which I think is very relevant to understand given the widespread use and evolving nature of social media and how it is differentially regulated and used in different jurisdictions. So if people are interested in these efforts, please feel free to email me about any or all. We've also been working together with other organizations like the World Psychiatric Association, and over the last 12 months, there's been a memorandum of understanding signed between ISAM and the WPA, and some of the initial efforts that we plan to undertake are with respect to webinars that would look at the intersection of addiction and mental health, and hopefully be relevant to both organizations and the membership groups. So the World Health Organization, which has given several presentations here at this conference, we have worked together as part of a series of work groups that have been held going back now about 8 years, that have focused on internet use and behavioral addictions. And these occurred in the setting leading up to the 11th revision of the International Classification of Diseases. And there were thoughts that that it would be good to bring together these work groups to consider how gambling and gaming and other internet use behaviors might be considered in ICD-11. And as we may have heard through different presentations, there has now been a new section within the ICD-11 entitled Disorders Due to Addictive Behaviors, where gambling disorder and gaming disorder are now located. And there has also been the introduction of hazardous gambling and hazardous gaming entities, and these are similar to the hazardous alcohol use entity that has been in the ICD for a longer period of time. And we believe that these measures, these latter measures, may be particularly important to public health efforts around the globe. So current efforts of the World Health Organization in this domain involve developing screening and assessment instruments. So for example, the World Health Organization developed the Alcohol Use Disorders Inventory, or the audit, and it would be helpful to have similar instruments that are psychometrically sound across different jurisdictions for gambling and gaming behaviors, and that is a current effort. And as we've heard about in several presentations from Matthias Brandt's group, among others, there are still many questions that remain about how we might consider a broader range of behaviors for which there are no formal designations in the DSM or the ICD. And these include shopping, buying behaviors that are problematic for people, or social media use that is problematic. And we have proposed that this other specified disorders due to addictive behaviors might be a relevant construct for clinicians to use to be able to see people and to be able to provide a diagnosis and perhaps in some jurisdictions obtain reimbursement for their services. Some of the other work that relates to, for example, social media use is we've conducted a meta-analysis looking at about 30 plus countries around the world with respect to gaming and social media use problems. And what we found when looking at gender-related differences was that by and large across the globe, gaming concerns were largely male predominant, social media concerns were largely female predominant, and if one didn't specify the type of problematic internet use, one may have lost relevant information. And if we look at this from a jurisdictional perspective, most of the countries show this relationship, and that's shown in the upper left-hand quadrant. But some countries showed a male predominance for both social media problems and gaming problems, like Taiwan and Germany, where others showed the reverse pattern that is seen in most jurisdictions like India. And so these types of studies then raise questions about what might be driving these differences in the jurisdictions. Another effort that is perhaps closer to the European home in which we've been involved is a cooperation in science and technology effort that focuses on problematic use of the internet. And this program that Naomi Feinberg and Yossi Zohar led focused on problematic use of the internet, and then the pandemic emerged. And so at the onset of the pandemic, a group involved in this cost initiative generated a consensus guidance on how to prevent problematic use of the internet during the COVID-19 pandemic. And then as more data were gathered, we generated a second manuscript that focused on good practices and mental health recommendations during the pandemic with respect to problematic use of the internet. Another product that was developed from the COST initiative was this e-booklet that one can download for free at www.internetandme.eu. That's entitled Learning to Deal with Problematic Usage of the Internet. And it includes information on different forms of problematic use of the internet, comorbidities, screening assessments, and practical tips that one can provide for people who are seeking help or for parents who may have individuals, children who are struggling with concerns in this area. Some of the other work that we've been involved in internationally has been with respect to thinking about impulsivity and compulsivity with the International Society for Research on Impulsivity and the International College of Obsessive Compulsive Spectrum Disorders. And from either one of these or both groups, we've developed consensus manuscripts on how to define and assess rapid response impulsivity, as well as how to define and assess choice impulsivity across species. And then we also generated an article that defined compulsivity and considered relationships between impulsivity and compulsivity that may relate importantly across addictions, but to specific aspects of addictions, perhaps in the progression of addictions. So in conclusion, while addictions are problems worldwide, it's going to be important for us to understand people who live in different parts of the world. I think that the organizations that I've mentioned are well positioned to work together, bring people together, and involve people. I think ISAM is in a particularly strong position, and I think that this global expert network is a very important movement, body of work that once the structure is in place, it should be very helpful for gathering information, then translating that information into better public health efforts worldwide. So I'd like to thank a large number of people and thank you for your attention.